You know, they call you an asshole.
Been called a bitch 1,000 times.
A knocked up whore. Get the F out of his effing room, you effing N-word. I've been bitten, choked, punched in the mouth. I had a guy try to kick me in my stomach while I was pregnant.
You push me past my limit, past my capacity of being able to multitask, something's gonna get missed. And when I say something, I'm talking about your mother. I'm talking about your father. I'm talking about your husband and your wife.
They may be at breaking point, but their bosses have warned them not to speak out. They are anyway.
So with breaking news at 6 as thousands of Providence doctors, nurses, and other workers walk off the job. It is a
From policymakers to frontline practitioners, we dive deep into the diverse worlds that make up our evolving medical landscape. Join us as we uncover success stories. Whether you're a seasoned professional or simply curious about the future of health, this is your gateway to the uncharted territories of modern medicine. Anas Abidrabu is your host of Uncharted Narratives podcast, Sirdiyat. Welcome to Uncharted Narratives. Today, we're diving into the world of Darlene Schindel, a powerhouse nurse, leadership coach, and catalyst for change in healthcare. She's a visionary who has dedicated her career to transforming healthcare from the inside out. With over 2 decades of experience as a neuroscience nurse, Darlene empowers nurses to rediscover their passion and purpose. As a transformational leadership coach, Darlene believes that every nurse has the potential to be a change maker. Her unique approach focuses on nurturing the whole person, body, mind, heart, and spirit. She helps nurses move from burnout and uncertainty to becoming confident, inspired healthcare professionals who can truly make a difference. Get ready for an inspiring conversation that will challenge everything you thought you knew about nursing, leadership, and personal transformation. Welcome back to Uncharted Narratives. If you're just joining us, we're continuing our second-part conversation. Now let's continue our journey and uncover more remarkable stories and insights.
Telling it being more open and conversing about these things. And again, there needs to be listening. Somewhere in the system, we need to have that listening. It needs to start with the first line nurse manager. And again, you mentioned earlier that nurses in academia are not wanting to go into leadership. And actually a colleague of mine and from Grant MacEwan University did a paper on this with another colleague from Mount Royal University. And they wrote about this reality that nursing students are not looking to be frontline leaders. And so that's another thing that we need to continue to investigate. And a lot of it has to do this. They just want to go and do their job. And we know that traditionally, the best nurse on the unit usually was the one, oh, you should be the charge nurse. But why? It doesn't have to. Let them do what they're good at. Let them do what they're best at. Yes, exactly. So for me, it's like, what's important to you and what is it that you want to do? So for me in my coaching, that's where I start because they have a heart. They just haven't been given the platform or the opportunity to say, this is what I love to do. This is what I'd like to do. And then nurtured along to actually get to where they really want to be.
So they are in mechanical ventilation and I have 4 patients. So imagine how my day. So when you mention you need to stop and take a breath, I cannot. That extremely, you remind me. So now I feel how much this is very simple thing just to take care for myself, to breathe. I cannot in that day. And one thing also you mentioned, I want to highlight it here for non-Canadian audience. When you mentioned you need to go for the doctor and bring one issue for you for the doctor. So I have next week a grass test because I have allergy from the grass here in Canada. So it doesn't work with me. My schedule is a scramble. So I called them. They said I cannot do it next week. Can please reschedule it? So they told me, yes, okay. When they schedule it, 25 February. So the earliest one after 1 month and a half. It's unbelievable. So imagine I am a patient. I need to come for you. And every 3 months, I give you one issue to solve it for me.
Yeah.
Doesn't work.
Yeah. Well, I'm very excited about the future of healthcare because we have the potential to make some changes and to to do that focus on like let's get and make sure that everybody has a family physician and that is being cared for by someone or has a home like a primary home health physician and team that they can go to and be cared for. So
I hope so. I hope so. So we make it very dark. Let's take it very positive right now. Share with me, because you told me right now, one of your coachee give you a good testimonial. If you want to share with me any success story, you work with frontline student, nurses or coachee, you take them out from burnout.
like they matter and that they want to be there. Because most nurses that I'm talking to now aren't there. And maybe that's because those are the ones that are coming to me and we're having that conversation. But, even online, when you look at what nurses are posting, they are struggling. So for me, it's about, let's just have a conversation. Let's find out where you're at and explore where you're at, because they don't have that person so, it's going to your example in the ICU. I had a nurse tell me that, in the pediatric ICU, again, the same thing that this happens, that more than 1-to-1. And again, now it's a child, it's not an adult. And yet, exactly. But again, so then you've got more patients. And when you're in the ICU and that's a 1-to-1 kind of ratio, you are much more isolated, I'll say, than if you're on a unit necessarily. And maybe that terminology isn't quite right, but you're by yourself. And the nurse told me that, she says, Darlene, I don't even know what my nurse manager does. I never get to see her because I'm in my unit with my patient and the family, which is usually around when it's a child. So she said, you're so consumed with where and paying attention to what you're doing, you don't know what's going on out here. So in situations like that, wouldn't it be nice to know that that nurse, that's your manager, has your back, and that no matter what's going on, you could go and get some help? But I think oftentimes now nurses don't feel that way. They don't know who's got their back. They don't know who's going to support them, right? And especially if they don't see their nurse manager very often. Every situation is different. But yeah, I there's lots of little issues that we need to hear the story from the nurses.
I have here something to add, but I don't want to spend more time because I try to take it more positive toward
Yes.
mentoring and coaching. But one of the things as a nurse, with all those overwhelm and shortage and high volume of the work, it is very normal with all those challenges to have any safety concern or have incident or medical error and being put in the in the side for patient safety. Because I've been in the health tech company, we are providing healthcare solution for patient safety and risk management. Most of the time, they configure the system, the leadership in the hospital in the way they told us, non-blaming culture, but there are blaming culture. There are toxic culture there. So as a nurse, I feel you and try to do my best. So I will stop here. We will not go further with that because we need to make it very positive and take this positivity from you. I see you still see a bright future. I hope, like you, to be honest, but I hope still you see there is a change in the future. So when you start your coaching approach, again, I see a new concept. You put it mind, body, heart, and spirit. I believe you need to go with the marketing or with the sales team. You have those fancy.
To me, that would be things like when you were talking about, do I love my job? Do I get paid fairly for what I do? That's very important. The mind is all about use me creatively. So when I talk to nurses now, they're saying, well, nobody cares. Nobody's paying attention. They're not including me in trying to, solve this problem or to even understand what exactly is going on here. So the mind is all about, the growth and development. And how much growth and development are we allowing for nurses? And then for the heart, that's about relationships. So how positive are the relationships on the unit that you're working on? How engaged are you with the rest of the team? A lot of the nursing units now, they don't even know each other. And what happens? They go for a break, if they even get a break. And what are they doing? They're on their phone, they're chattering, they're this, they're that, they're trying to, so how we interact and how we are not interacting with each other is important. And then the last one is all about leaving your spirit, body, mind, heart, and spirit. That's about leaving a legacy. And so that's about what gives you meaning, what gives you contribution. That's, this is where nurses saying, I just want to serve. I want to serve. Maybe they don't want to be the leader, but they want to care. They want to provide this care. Now, the interesting thing is that people never talk about that. An organization also has a body, mind, heart, and spirit. And usually where the disconnect is that for an organization, it's about the financial end. Well, we can't afford to have more nurses. Well, you can't afford not to have more nurses, or you're going to have no nurses. And then for the mental component, body, for the mind, that's about growth and development. So how much growth and development are we providing from an organizational standpoint to our employees? And that's the thing that I'm now doing a big focus on, helping organizations to bring that growth and development from an organizational perspective to their employees.
So what's your message for those organizations about the value and added value for empowering nurses and frontline? It's look like obvious, but tell them, what is the added value if you empower your frontline?
Well, the added value is that, again, it's staff retention. It's decrease in illness. It's a decrease in, what we are, the ultimate goal is, for me, when I'm working with anybody, is work-life harmony. Do they love their work? Do they come home feeling like they've mattered that day? They come home and they feel like they can care for their families. They can be with their families. They can look after their needs. And there's harmony. There's harmony between work and life, and they have joy. That is my ultimate goal. And the employer has a responsibility in there to help that happen. So body, mind, heart, and spirit of your nurses, and there's a body, mind, heart, and spirit of an organization. And nurses are going to be going to those organizations that have their body, mind, heart, and spirit together, and are there going to support the nurses that work with them.
Right. One of the things both of us, we been chatted and discussed about Nursing Sustainable Initiative and their platform. And you encouraged me to apply there. However, still I'm waiting their response. So can you please tell us what is that initiative and what they do?
Well, so Nurses for Sustainable Care is an organization that was started here in Alberta. And we're just gathering nurses because over the pandemic, it became obvious that nurses needed support. And so there's different groups of nurses that have gotten together. And the whole idea of Nurses for Sustainable Care is to invite nurses to come together. It's not just, there are many organizations that are there to help nurses that have had burnout, and specific. The Nurses for Sustainable Care is about inviting nurses to the conversation, to the table, to understand exactly what we've talked about. What are the issues that they're dealing with in whatever work area that they're in? And what is it how do we take then in the healthcare system, in the healthcare government, that kind of thing. So what is it that that needs to be heard from the nursing profession? And so we investigate it, we look at the data, we look at the research. It's about how do we take that message up to the policy within government to bring about changes. It's about moving the needle within policy as much as it is within the personal support for nurses.
Now, for me,
and in that context too, if I could just add, oftentimes it's information and context and knowledge that nurses need. So, for example, when the issue comes up about, well, we're going to eliminate single-use plastics. Well, wait a minute. Do you know how much hospitals depend on single-use plastics? So again, it's about It's about not just saying, oh, these big issues up here and this is how we're going to do them, but it affects people in their work and their role. So we need to be able to, how does that apply in our setting in healthcare? So there's lots of issues like that. So it's also bringing knowledge to nurses that they don't get elsewhere.
Yeah, I can see this. I never thought about the one-use plastic, how it's affected healthcare. Interesting. Yeah, this is the beauty when you sit with different perspective, different stakeholder and discuss together. One of the things for me is it's not clear now, and excuse my lack of information. I am out of the practice, and you are in Alberta. I am in Ontario. Also, for who don't know, every province here in Canada have their own legislative and their law. So what is the role of nursing council if they are not taking care for their staff and nurses of all those stuff? So I am assuming if there is role for the council, such as initiative for sustainable nursing initiative, it will not be there. But you came to fill the gap which is there. So what is the role of the councils?
What council are you? What council are you talking about here?
Nursing council or the union of the nursing who is taking care for the legislative of the nursing and make sure.
Oh, you're talking about a number of different things. So there's the College of Registered Nurses. Every province has a college. Their responsibility is to protect the public. Associations, like every province, has an association of nurses. In Alberta, our association includes licensed practical nurses. It includes RNs, psych nurses, nurse practitioners. So the Nursing Association is there to support the nurses in their practice. So that is a different role. Every province, the health is a provincial jurisdiction. So yes, there's the government of Canada has, a health department, but every province, just like they make decisions over education and nurses and the practice and patients, but they're there to support and to negotiate on behalf of the nurses. The question is, are they really hearing all the things that nurses are wanting and would like to have? And again, it depends too whether nurses are bringing their voice to the table for that as well. But don't forget, once you're in management, you're not part of the union anymore, right? So it's for frontline staff. So again, that's a whole nother thing. And there's probably other organizations. So for example, in Canada, we have all kinds of specialty nursing groups. So I am the past president of the Canadian Association of Neuroscience Nurses. So we had across the country, every province had had a chapter in neuroscience nursing. We have orthopedic nurses, intensive care nurses. We've got all kinds of amazing professional associations of nursing. And so they're there to support and to continue to educate and, for their particular area of practice, operating room nurses, cardiovascular, pediatric ICUs, like all of those. And so there's a lot of support for continuing professional education within those organizations. So within the system too, that nurses need to sort of figure their way out or in.
So what you do in this initiative, in sustainable care initiative, what you do and develop and support the nurses the other they don't do? How you support them for something is not
we're
there?
Just getting started. So you'll be hearing soon about coming to a conversation. We're going to start to have some engagement with nurses, and we'll do it virtually so that nurses can join from wherever and then listen to them. But we're also going to bring some not training, but some concepts. So bring some information, new ideas, like this is what's happening. What's your response? So for example, if you have a question about, here's something that happened, I don't understand why this happened this way, or here's a problem that I had. well, is there something that needs to be, that we need to look into? Why does this happen? Or what support isn't being offered in that? And then look, what's the research? What do we know about caring for these patients? So it's something that the nurse doesn't have to do all this work themselves. They can come together as a group, and then that we work together to address the issues and find out the information and the research and what the stumbling block is for that to move this forward or to address an issue.
And I'm happy to be part from this initiative again, and looking forward to see how I can add value with your team and your initiative. So now let's move. I think you give it enough your work with the NSTEB and working with the school. And now I need more focus about the nursing healthcare lead. So if you can share insight for.
Well, when it comes to the leadership, one of the things that in working with the nurse leaders is to say, for example, are they offering continuing education, skills training? How are they continuing to support the nurses at the bedside? And so as an organization, if I'm now, and I've had a lot of requests from organizations to, for example, do some support during International Nurses Week. And I had an amazing opportunity last year with the primary care unit. And it was great to bring some continuing education and a session to nurses. But how can we also do that on an ongoing basis where it becomes like, just like if you're having a monthly team meeting, well, maybe you need to have some tools, some training, some support in how are we doing this? And also to listen when they say, okay, I need, this happened and I don't know what I should have done. Or nurses don't even feel like they have the trust of their leaders to be able to bring issues, which we need to fix that, right? But I think there is just as much support lacking for frontline nurse leaders as there is for the nurses themselves. And so that's another thing that that a course can do. So I'm working on a course or two that people can take, but also then making it talking to individual nursing organizations and employers to say, what is it that you need for your nurses? It may be different than, if acute care might have different needs than a long-term care facility does. But again, having a time when nurses can come together and can talk about things and feel like they're being heard and they get some training as well, or some tools to help them with and make some changes to their workplace so that they can address those issues. I think that's where the conversation has to start.
Oh, let's back. Okay, Darlene, now you mentioned the leadership and the front line. I'm curious to know from your experience or from your perspective, who is easier to work with as a coach? To work with the leader or with the front line?
To me, it's not a matter of easier to work with, because they're still individuals. Even if I'm coaching someone who is in a leadership position, what they're talking about may be different than if I'm coaching you. And let's say you're working in a front line and you have in a specific nursing, like in the OR, or you're a bedside nurse, or you're a long-term care nurse, or whatever, or you work in a doctor's office. So your work role could be quite different. So it really is about, what's important to you? What do you value? Going back, what do you really love to do? I think sometimes, we get into a job or we take a job or, how many people have I talked to just in life in general? And, sometimes this is cultural. I've had people say, oh, yeah, I went into this because my parents wanted me to be a lawyer. I can't stand it, blah, 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 this kind of stuff. Like, so there's all kinds of things that happen to people. And sometimes choices are made for them, or they have an expectation within their culture or their family that you're going to do this. You're going to be a lawyer like your dad, blah, blah, blah. When really what we should be doing is listening to our kids as they're growing up to see what's kind of pulling them. What are they good at? And letting them figure out, what am I good at? What do I love to do? And then going from there.
So if I understand, and correct me if I'm mistaken, So everyone have their own story. They are different. But
Oh, sure.
The role maybe contribute a bit, but this is it depends how much you understand yourself, your soul, how you are connect. As much as you connect, as much as it's easier for you to take that person in his or her journey. If you are not aware about your value, here where you spend more time. Is that correct?
Yeah. And you know what? Sometimes there are nurses who need to be given permission to leave nursing, right? So,
Even
because,
from
well,
who?
again, so sometimes if you've heard all the stories, sometimes the most difficult place is in a nursing unit because we're like this. It's not just the up and down in between, but sometimes within a nursing unit, we're not supportive of each other. And somebody else is being a bully and somebody doesn't, and so sometimes there are nurses who, they're not even aware. They don't have that social emotional, their awareness about how they're coming across to people or how they show up at work every day or why nobody is kind of, wanting to engage with them. And so sometimes there are nurses who, they really don't want to be in this job anymore, but it's all about the pay or they can't leave the job so sometimes it's a matter of helping them to see, again, what are you good at and what would you like to do? And finding a way for them to let go of what they don't want in nursing and to do something else. And you'd be surprised at what comes up when you're working with people. Sometimes it's totally different out of the blue. Sometimes it's just a minor shift, from being in acute care to doing something that's a little bit more community based or whatever. But again, unless they talk to people and talking to someone at home, maybe they have a supportive family that can understand that. But if there's issues in the family and they're the ones who are saying, well, you can't quit your job because then you're going to be in a real trouble. So they come to work every day pressured because they feel they have to be here, so everybody's story is different.
Yeah, I like your background. It's amazing, and I will do it right now. Also, again, I like what the way and the art and the
Did I
how you
tell you
connect
about
the
the lamp?
vision. Yeah, tell me about it.
It's
Yeah,
something called
I know the story. I know the story, but tell
okay.
our audience.
So nurses, you all have a lamp. This is like the Florence Nightingale story, but there's lots of amazing, amazing nurses that were leaders. And remember, the light in the lamp, it's your values and your beliefs. And, sometimes we don't pay attention to them and our light starts to dim and the people around us are not there for us and the burden gets so heavy. This is who we are. This is our lamp that supports everything about us and our work. And sometimes we just put it down. And now we're at a loss. We don't have all those core things of who makes us to be who we are to be. And that's why I called my program Light Your Lamp.
It's so deep, and also the vision out there. I like it. So
Yeah.
you are very positive and optimistic. How you see the future of the healthcare?
Oh, I think nurses are going to be leading the way. Really, truly think that we're the largest healthcare professional group, and we are going to lead the way. So one of the things we're dealing with now is get the nurses that, let's get them healthy, be engaged in their work, and also leading the change that needs to happen. So we just need to make sure that we have the people, the nurses are there, that they're in something that they love to do, and that we're going to learn from them what the next step is. And is going to happen at the grassroots level. It's not going to come from up top down to say, this is how we're going to do it. What we're going to do is we're going to engage with technology, with AI, with all of those things. But the solutions are going to come from the grassroots, from the nurses. They're the ones that are going to say, okay, if we have an issue with how we're treating, we're very multicultural now. We know that healthcare research is mostly done on white males. Well, that's changing, right? So that we know that we need to look after Black women differently than white women when it comes to breast cancer. We know lots of things. We need to do more knowledge translation at the grassroots level. So we need to include academia. Yes, you're doing all the academics, but how are you helping us to translate that into everyday care? So there's a shift coming here. There's a shift coming here. And Anas,
I
I think
can
we're going to be on that shift together.
yeah, for sure. I can see your smile, and I'm happy you are seeing that very positive. And yeah, I'm sure. As I told you, I see Canada. It's my home, and both of us we connect in order to see how we can improve the system. My own,
Oh, no, every person is unique. You have your own uniqueness. I can support you in finding out what your uniqueness is, or helping you to see for yourself what your uniqueness is. And that's what we need. That's what we need. We don't need more of me. We need more of people like you doing what you're passionate about. Yeah, and the other person, the net person beside you, and to me, that's what as a leader, when I was in frontline leadership, for me, come and sit down with me, and you would do your performance review. You would tell me how your year's going, what you want to work on, what's not good, what you don't like, what you do like, and then I would give you feedback. But I didn't have to tell you, oh, Ines, this is what you're doing right or wrong or whatever. You just shared with me. But then I came up with, I found a tool that I could use. All my staff anonymously filled out this tool to give me feedback on my role as a leader and how I was showing up for them as their leader. And you know what I learned from that? The
what?
number one thing that I learned from that is that they trusted me. They trusted me that if anything went wrong, or if they were in trouble, or whatever was going on, that I would always have their back. And to me, as a young nurse in her first leadership role, that to me said, that's what leadership is all about, that trust. And that's what I hope every nurse can
And
have.
you know what? This is a golden value in the nursing. It's very hard to get trusted from your front line. So most of the time you will find this a conflict and mistrust. If you have that means you are amazing. And
Yeah,
you
and we
are.
need to get more trust between ourselves and between our administration, and we can have it. We can.
So if I want to connect with you and know more about you and know more about services, how I can connect with you?
I will share my information. You can find me on LinkedIn. I'm happy to connect with you, whether you're an employer or you're a frontline nurse. Please just connect with me, and be happy to have a conversation and to see how I can support you. I have a website, and I love to start with a conversation.
Yeah, we start with the conversation, and now we are more than 2 years working together. So, Darlene, how do you want to close our episode today?
All I want to say is you matter. If you're a nurse in the system, if you're struggling, wherever you are, just know that where you are, you matter. You matter. And don't let anyone tell you that you don't. And if you need to have someone to listen to your story or to hear your story, or you just want to share something, please connect with me. Because we need to all be sharing each other's goals, what you're bringing to the table. It matters.
Thank you for your time. Really, I appreciate it. You make my day. Thank you. Bye-bye.
If this episode sparked something in you, here's how you can keep our mission alive. Subscribe to Uncharted Narratives Surdiyat. Leave us a 5-star review. It helps more amazing people discover our stories. Share an episode that moved you with a colleague or friend. Connect with me on LinkedIn and join our healthcare innovation community. Together, we're not just telling stories. Until next time, stay curious, stay passionate, and keep pushing the boundaries of what's possible in healthcare. See you in the next episode of Uncharted Narratives Surdiyat.